Imagine, one day you wake up feeling ill enough that you go to the doctor. We have all been there before where we wish there wasn't a magic pill that would take all our symptoms away. In this case, your doctor may prescribe an antibiotic, but after a few days, you still are not feeling better. But why? Antibiotic resistance is a huge problem in today's world. It is defined as the resistance of bacteria to an antibiotic that once worked to kill it. This phenomenon happens as doctors prescribe more and more antibiotics to patients that may not help them, such as patients with viral infections. When given an antibiotic, it is non-selective in which bacteria it kills. So the bacteria left is often resistant bacteria that remain able to grow and reproduce in the body. The stronger bacteria now have the opportunity to spread to other people through contact with the carrier or objects the carrier has touched. Antibiotic-resistant bacteria are known as multi-drug resistant organisms, and the list is rapidly growing while our ability to effectively treat is decreasing. So the question remains, what can you do about it? The most important thing is to wash your hands and properly, using hot water, soap, and rubbing together for at least 20 seconds. The second is handling raw meat safely by cooking to temperature and cleaning surfaces the raw meat has touched. Lastly, question your doctor's prescription. If you question your doctor's prescription, if it's not working, they can prescribe you something that may. Also, finish your course of antibiotics in its entirety. Leaving some out still allows bacteria that have infected you in your body, allowing them to grow and may continue an infection. So what will happen if this continues? There have been several cases of infections by what they call superbugs. These bacteria are vicious when infection occurs because there is often nothing hospitals can do to treat it. Any bacteria can evolve to become one of these superbugs, meaning our ability to treat will decrease even further. MRSA, or methicillin-resistant Staphylococcus aureus, is one of the most monitored infections in hospitals because it is the source of most hospital-acquired infections. Policies and regulations have been put in place to stop the spread because about half the population is actually colonized with these MRSA bugs. Alternative treatments are being developed, such as phage therapy. Phage therapy is the use of bacteriophage viruses that inject DNA into harmful bacteria to kill it. The problem with this is that it is costly and not always guaranteed to work. Antibiotic resistance is not talked about as much as it should be. However, if you take the steps to educate yourself and do the steps necessary, such as hand washing, food safety, and drug safety to prevent it, it will buy scientists more time to find better treatments to treat infections.